Well, for the first time in more than a decade, drug overdose deaths declined in DuPage County. They were down 24% last year compared to the previous year. No one is declaring victory, but we wanted to dig in to see what's working in the western suburbs. Greg Hart is a former DuPage County Commissioner, and he served as the chairman of the DuPage County Heroin Opioid Prevention and Education Task Force. Greg, thanks for being with us. I know you emphasize this. There were still 114 overdose deaths in DuPage last year, but it's a significant decline. And what do you attribute that to?
Well, first off, thank you for having me, Ben. I appreciate the opportunity to be on. And it is certainly heartening data coming out of DuPage County. But as you said, the fight is still often continuing. By no means is anyone taking a victory lap. But I think if you look at the data in the 24% decrease, and in particular how that differs from some of the other counties we've seen across the Chicagoland suburbs, the only real point to make, I think, is the emphasis that DuPage has put on harm reduction. For a long time, since 2013, under the leadership of Coroner Rich Jorgensen, DuPage has really prioritized making Narcan, the life-saving drug naloxone, available to different stakeholders, including police departments, schools, and now to the general public. And I think the increased prevalence of Narcan and the availability in DuPage County certainly is playing a role. According to some of the data that I've seen, nearly 7,000 individuals in DuPage County have been trained on how to administer this drug. And just in the last 4 years, over 2,000 individuals have been saved as a result of a Narcan.
So I think that's playing a big role. By Narcan. That is amazing. And I know, I think every police agency in DuPage now has Narcan, and officers carry it with them on the streets. Even with the improving numbers, though, there are still some concerning trends as you dig a little deeper. Tell us about those.
Yeah, well, increased prevalence of fentanyl in the overdose numbers. And we've heard about fentanyl for years at this point, but 70% of the overdoses in DuPage County in 2023 involve fentanyl. This is similar to what we've seen in Cook County, where 91% involve fentanyl. And if you even take it a step further, the idea of polypharmacy overdoses that involve numerous drugs, that is on the increase. In fact, in Coroner Jorgensen's report that was just released, it was very commonplace for him to see nearly 15 different drugs in people's systems, unfortunately. So that's something that we're going to have to keep a closer eye on as we proceed. And
also a reminder that you really never know what's in a drug that you may be taking, no matter what a person who sells it to you or gives it to you might say. The Cook County Medical Examiner, I was looking up their numbers. They previously said that when all the toxicology testing is complete, they expect to find the number of people who died by opioid overdose to be nearly 2,000 people, which is near record levels. What else did you find that worked especially well in DuPage County as part of the task force that you were involved with?
Absolutely. I think decreasing stigma for treatment and recovery is critical. In DuPage County, I remember when I served as chairman of the HOPE Task Force, I saw data indicating that 2,000 young people from DuPage County had to seek treatment in the city of Chicago because there weren't enough inpatient treatment options and availability to service them. That's something that I know the county is addressing, and Chair Conroy, to her credit, has just launched a new crisis recovery center where people who are struggling with a mental health or substance use emergency can come and get the treatment that they need. But the options need to increase, and more importantly, as a society, we need to destigmatize seeking help for addiction. Additionally, we've created opportunities for people who have taken the initiative to get themselves into treatment. Yeah. DuPage County won national awards when I was on the task force for a job training program. Individuals who were in treatment and showing promise in that treatment, we connected them to DuPage-based employers for that the best predictor of someone's success or recovery was employment status. So I think it's those innovative approaches, Ben, that have really led to the success that we've seen in DuPage County.
A bunch of different approaches. Greg, thank you for being with us. If you need help or know someone who does, you can check out resources at hopedupage.org. And they also offer free Narcan kits there. Thank you very much, Greg.